All right, so I want to give you some context. We hope you saw the first video here that talked about how I tore my rotator cuff back in the middle of winter, what I've kind of done to progress through that. Now that was a really overview of how it happened and what I've been doing to be helpful for myself. But we also know people deal with these weird rotator cuff and shoulder aches and pains all the time. So we want to have two separate parts to this video series to help you go through, one, how do you approach movement and exercise when everything seems to bother or hurt? And what are the kind of lower level exercises to start with? And then part two is going to be really focused on kind of those more advanced exercises and concepts to ramp you back up into fitness. So in part one though, I want to really focus on how do we approach these low level exercises? Because it isn't as simple as just going to do TheraBand, rotator cuff, internal external rotation, or squeezing something, right? There's a whole host of stuff that goes into the rotator cuff because of its functionality, right? It's not just doing a motion, right? Your quadriceps kind of extends your knee. We understand that, so we can kind of work on that. The rotator cuff functions in a host of ways. Most importantly, keeping that shoulder kind of in place of where it needs to be, in addition to rotational aspects. So it's not as simple as just doing the motion that the muscle or tendon does, but you also have to consider what is its other functions in different types of motions where it might not be the primary movement. So all that is to say, we have a host of exercise, and almost any shoulder exercise can be a good rotator cuff exercise. It just depends on how it feels to you and then how you integrate it. So let me dive a little further into that now. So for example, what I want to talk about, the easiest part first, is that you want to always start with some isolated movements, right? So what I'm going to kind of walk around here and show you is something that if you've ever had PT before in a traditional outpatient orthopedic setting, you've probably seen some version of TheraBand here, where you tuck your elbow to the side of your body, you then rotate in, or you might be doing the other side, where you rotate out and you go through. Now, we've had a lot of history of making fun of these, but they have their place in rotator cuff exercise. One, because the closer you are to your body, the safer your shoulder generally feels. If I were to do this way out here and try to go up here and crank out the same rotation, I can already start to feel how that doesn't like me. So rule number one is when you start with isolated rotator cuff exercises, keep it close to your body, and the closer it is, the less probably aches or pains you're going to have. The other part of this is how is the rest of your body set up? Now we typically look at this exercise, we want to see where are your ribs and shoulder blade, as well as what is your neck position. I'll see people doing this, but with their neck cranked forward, and they just feel a whole bunch of gunkiness in their shoulder. So I like to maintain a nice neck position. I try to find the right shoulder position where I just feel my rotator cuff working. Now that usually typically is felt in the back side of the shoulder like a muscle burn, not in the front of the shoulder like a joint burn type sensation. Now for those of you who've had that pain for a long time, that probably makes a whole lot of sense, right? I don't want to feel like an arrow is burning right through the front of my shoulder, but I do want to feel some muscular fatigue. So whether you're doing the banded rotations or the rotations we showed you in the first episode, distinguishing between what is the rotator cuff muscle fatigue working and what is that sharp burning arrow in the front is a great place to start. So after isolation then, we want to kind of integrate this into a more holistic approach. And this is where we get into the functions of the rotator cuff. Now I have a 30-pound dumbbell here, and ironically and most importantly, the rotator cuff works in combination with your grip strength. So your grip strength is correlated to how strong your rotator cuff is. It's a really important concept because what that means is we can do a relatively safe position for the shoulder, which is holding right next to our sides, with a heavy weight, squeeze it as hard as we can, and we are reflexively working our rotator cuff. So all I'm doing here is taking my pinky finger, thumb, and little finger, squeezing as hard as I can on the dumbbell, and I'm just holding and working that in combination with my isolated exercises. This will feel fatiguing all over the place, but it's a great low load, low stress way to affect that rotator cuff. Oftentimes, if you're holding stuff like that for 45 to 60 seconds, that initial burning pain can actually feel quite a bit better, or what some people describe to us as PTs is kind of loose, right? So we had our isolated movement to where do you feel it? Is it that muscly burn fatigue, or is that kind of joint fiery fatigue that we don't quite want to stay away from? Then we do the integration thing, which has to work with the grip strength for. Now, once we've gotten those two things, we want to move on to a more holistic movement, such as a row or a press. What I usually start off with people first at the beginning is stay away from anything overhead initially, because that's the most stress on the rotator cuff when we work through it. But what I do like to start from is either a pressing position here or a rowing position here where we're going right in front of our chest. Now there's a couple ways you can do this. The first one that I love to start people on is just a front plank, right? It's a isometric position where we come down like here. I start them off in this position. I have them push the ground away from them, and I have them move both their neck and their shoulder blades until they feel like they don't feel the front of their shoulder. And I have them just hold it there. Again, hold it for probably about 30 seconds or so, and as long as you have no repercussions from that, that can be a great isometric for you. The other part of this could potentially be a press. Now, I always start with a floor press instead of a bench press, because I don't want my elbows to drop below my back. So what I do from there is I'll take one arm, lay it all the way down on the ground, sit with my forearm here, and I'll press up. And if I don't feel any goofiness in the front of my shoulder, what I'll do is just hold that position at the top and try to maintain it, and then go slowly back down, and then repeat that. Slowly up, as long as I feel my chest, my upper back working, and then I hold that position for 30 seconds. So the theme and the name of the game here is find these what I consider little lower level exercises, but it's holding those positions for long periods of time, making sure we feel it appropriately. The last part of this that will encompass both this first part and the second part of this video series is making sure that we're able to comprehend what should or should not be felt. Now, the rotator cuff, and typically we feel it in here, is a tendon issue. Tendons are ones that will often feel really good in the moment of exercise, but in a delayed way will often flare up 24 to 40 hours later. So what you're doing in the moment might feel great, but you won't really know the effect on your shoulder until about a day or two after. And that makes it increasingly frustrating. So what we always say, rule of thumb, is on a 0 to 10 pain or discomfort scale, that if it's anything below a 3, it's okay. And it has to be below a 3 during, the evening of, the morning after, and 2 mornings after. And if that is the case, then you can add a little bit more weight, a little bit more sets or reps to those particular exercises that we just laid out. The last part is, the common symptom we get for everybody when they start to have rotator cuff stuff is, well, if I do this and do that, I hear that clicking sensation or sound. The clicking in itself is not necessarily a bad thing, but when you're feeling it during the exercise you're trying to perform, we generally want to stay away from that. So what I'll have people do is focus again, neck position, shoulder blade or posture position, and if that removes the clicking and snapping sound, then you're probably on the right track at the right position for your rotator cuff. So, wow, it's a whole lot of info in the first part, and there's a second part coming along with this. But the big key takeaways are, number 1, you need to know where you're feeling the exercises you're doing. Number 2, the rotator cuff functions in a host of ways, and that it can involve just working under grip strength. Number 3, any lower level movements for that rotator cuff should be done close to the body. None of this raises out here or out in front of you or overhead until you're ready to pass the first parts that we've just gone through here. And the last part is, how is your body, pain, and shoulder responding? During, the evening of, and the morning after should all be below a 3 out of 10 discomfort and pain for you. If you can follow those, you have a nice kind of setup for these 3 exercises. And then in part 2, we can go over how to advance and have a higher concept for those rotator cuff exercises to get you back to fitness as well. So if you like this or you haven't checked out the first video, please go do so. You can check us out on YouTube or subscribe to us at Recharge, or you can check us out on our website, rechargexfit.com, to see any of these videos we have. And I hope you can tune in for the next part of this video series about rotator cuff injuries and exercises.